Hi everybody, welcome to Healthline. I am Gregory Zarian. Okay, spring is in full bloom. So that means you're spending more time outside, you're hanging out with your friends, you're getting off your computer, putting your phone down, spending time as your family. I say that all the time because, as you know, our mission here at Healthline is to have you be the healthiest you can be, and that means living a healthy lifestyle. So healthy does not mean looking like this, because if you look like this 10, 12 hours a day, what does that mean? You're gonna have to turn on to our show about back and neck hair. So deep breath in, deep breath out. It is spring, and that also means that we're spending more time outside. We're working out more, we're hiking more, we're swimming more, we're more active. That also means you can hurt yourself more. So what is it when you are just say throwing football with your friend, throwing the ball with your friend, and all of a sudden you throw it, you throw a pass, and you feel a tear. You feel something happen in your shoulder. Did you pull a muscle? Did you pull a joint? Did you do something? Or is it the infamous rotator cuff tear? Right? Right. Joining us from Adventist Health Glendale, Dr. Sevag Bastian. Doctor, welcome.
Well, thank you.
And we're matching.
And we both look great too. A couple of studs over here.
Right, you said it. I know. Hey, this is, yes,
yeah,
double studs. And we didn't plan it. My intro, throwing a football, throwing a baseball, swimming.
Right.
Easy ways to knock out your rotator cuffs on each side.
Very easy way, and especially if you don't have the right form. So it's not just the shoulder. Comes from the back, the trunk, the core, and even the legs. That's what we used to do with a lot of our pitchers too. Make sure that everything is in sync.
Because most people think, doctor, that, you know, as my older brother Vincent, I so love you, you know, you get back, you cock the football or the baseball and you get ready to throw, that there's so much energy coming from here, but it's a full body motion.
Right, right. And the most energy is when you're cocking it back, but everything is working as a unit. So you have to make sure everything is in sync and good to go.
Do you find that most people get hurt in sports, per se, in regards to what we're talking about, football, baseball, swimming, because their form is off?
Almost all the time.
Okay.
Almost all the time. So a nice tune-up at physical therapy is always recommended. Go over the proper form, mechanics, and make sure everything is up to speed. Because you're as strong as your weakest muscle, but also if all your muscles are not working in unison, that's when things get hurt.
And this also goes back to when you actually learn a sport or learn an activity.
Right.
The most important thing is to be really clear in regards to the mechanics of doing it properly.
It's all about the fundamentals.
So, Vincent, when we come back, I'm going to really show you how to throw that baseball. Just kidding. Okay, so get up, get a glass of water, take a deep breath in, take a deep breath out, turn off your phone, turn off your gaming piece, and come back and bring a friend or a family member to watch more about what happens if you have a rotator cuff injury. Could it be bursitis? Could it be arthritis? And do you need surgery or don't you? More when we come back. Don't go away. Welcome back to Healthline. I am Gregory Zarian. The conversation is all about rotator cuff surgery, and how to sit up straight, how to engage your core, how to move properly so you don't get hit. Joining us from Adventist Health Glendale is Orthopaedic Surgeon Sevag Bastian. Doctor, before we dive more into rotator cuff and the do's and the don'ts and what to know and what not to know, give us some of your medical background, please.
All right, so I'm from San Francisco and I went to UCLA. Then I did my medical school training in Chicago, so I got a good Midwest experience. And then I did my residency in the East Coast, in Rutgers, in New York and New Jersey. So tough, gritty, Northeast kind of weather and people. And then came back to the West Coast, AKA the Best Coast. And I did my fellowship at the prestigious Curlin Jobe Institute, where we worked with a lot of pro athletes and celebrities and things like that. But now I'm in practice at OSS, Orthopaedic Surgery Specialists. Okay. We're based in Glendale now. We have a second location. And I'm right there on the Glendale Adventist campus at the PMT building.
Doctor, out of the gate, what is your rotator cuff and where is it, just so in case somebody's watching, they don't know?
Right, so a lot of people always ask me that. They're always confused. What is it? Where is it?
Because a lot of people talk about it.
All the time. And one of the biggest mistakes everyone always says is rotator cuff. So it's not the cup, it's the cuff, just like you said. There are 4 muscles and they become tendons as they insert onto your shoulder. So there are 4 muscle tendon groups.
Okay.
And each one has a different function. So
Okay.
they help you rotate your arm.
So do me a
raise your
favor,
arm.
since we're sitting here, I love show and tell.
Yeah, yeah.
So let's use, speaking of rotator cuff surgeries, I'm due to have one in a month.
Right.
So let's break it down. The 4 areas are.
Right.
This is where my shoulder. Rotator cuff is.
So it's deep inside, it's in your
Okay,
shoulder.
great.
And all the muscles originate on your shoulder blade or your scapula.
Okay.
There's one in the front that
Okay.
comes and inserts right onto the front. So when you contract your muscle, what happens? It shortens, right?
Yes.
So when you bend your bicep, it brings it up. When it originates here and inserts here, and you try to shorten it, it'll rotate it.
Got it. Okay.
There's 2 like that in the back. So when they shorten, they bring it out.
Okay. So this.
That's bicep.
Okay.
But rotating is all through the arm over here, the shoulder.
Okay.
So you got 1 in the front,
Okay.
you have 2 in the back,
Got it.
and then you have 1 up top that, when it shortens, brings it up.
Okay.
So those are the 4 rotator cuff muscles, or tendons.
And isn't it true that the rotator cuff is the most active joint in the body?
Sure. So the shoulder naturally is the most unstable joint in the body. That's why we can do all sorts of crazy movements on it. That's why you see the pitchers throwing like crazy and everybody cocking back their arm and getting into crazy motions. So because it's unstable, it's reliant on the rotator cuff to provide stability, not just movement. It actually is more important for stability. So when one of them gets torn, it throws off the biomechanics of the whole shoulder. That causes it to kind of slide out of place, throws off the center of rotation, and it just kind of throws everything off. So once one thing is off, all the other things start working.
So is it a
extra hard.
trickle down effect?
It's like a domino effect, exactly.
As I said, I'm having surgery. Torn,
Right.
couple torn ligaments in my shoulder due to a car accident, and also wear and tear in life and things going on. It has been so painful, but the beautiful part of everything that I've gone through is I've learned how to rehabilitate my shoulder prior to this surgery. I've learned that I don't engage my core as much. I learned that my body posture when I'm driving in the car is more hunched than proper.
You're gonna make me want to sit up straight right now.
Great,
too.
thank you. So let's all truly, but let's all sit up.
Yeah.
Because one
a good
thing
reminder.
that I love in regards to my team, which I'm now inviting you to be part of my team, is how important it is to maintain proper mechanics all the time, so that when you do get hurt or you do have a tear or a pull or something, your body is set up to handle it.
And you're absolutely right. You're absolutely right. I mean, it all really starts from your core. And it's funny because when we look at things like balance or core, when people are coming in for shoulder problems, they think I'm crazy sometimes. But it all kind of starts here. And if this is strong, your trunk is well supported, you're standing up straight, and it puts all your muscles and all your bones in the appropriate position, allowing them to function as efficiently as possible. So when your biomechanics are off, certain muscles will overwork, and that stresses them a little bit too much. Overuse with time, that kind of starts a little tearing, a little injury. So you always want to make sure all your biomechanics are on point, starting with your core. And another thing we always focus on are your leg muscles, actually, especially for the throwing athlete, like football
Sure.
players and baseball players. We always want to make sure they're really well supported with their trunk, not just core, but the low back muscles, the hip flexors. These are all key. Even though it's the shoulder, it all starts from your core. It all starts from that first step you take to throw the ball.
Most people work a 9-to-5 job. We spend a lot of time in our cars.
We sure do.
We sit like this. What's a simple solution to engaging our core when we drive?
The simplest solution is almost like cheating. There's
Okay.
there's a shoulder shirt or posture shirt you can wear underneath your button up.
Okay.
And it just kind of forces you to bring your shoulders back a little
Okay.
bit and stand up straight. And we're all bad at this, including myself. But when you wear one of these posture shirts, it really does help you kind of sit up straight, and everything you just get a different view of life, a different perspective, and it's the correct perspective. And it definitely puts your shoulder in the right place as well. So that's definitely key. Another simple thing is to do any kind of core exercises when you can at home.
But even when you're driving, like my physical therapist at Adventist Health, hi Justin, always, he will send me random text messages
Yeah.
that says 15, which means just 15 seconds of holding in my core.
Yeah.
So it's not sucking it in while I'm hurting, it's just engaging my core muscles.
And another good way I like to cheat in the car is to set my mirrors, my rear view mirrors a little higher, forcing me to sit up straight, so I actually get a good view of the back. That kind of forces it too, but be careful, don't overuse your neck. Make sure you're kind of sitting upright from your core, and then that way you can actually see the mirror a little better.
Nothing too extreme, but okay, ready? So let's engage. Are you engaged? I'm engaged, doctor's engaged. When we come back, we're gonna share with you signs and symptoms for what a rotator cuff tear is. Don't go away. Welcome back to Healthline. So is your core engaged? Are you sitting up? Are you not overextending your neck? Proper alignment just helps you lead a healthier life. All of this works together as one. So if there's a little kink that's off, slowly it breaks down how in alignment we can be. Joining us from Adventist Health Glendale is Orthopaedic Surgeon Dr. Sevag Bastian. So I was just thinking of this as I was doing my intro. Even sitting like this though, is it okay for me to have a leg crossed and engage my core?
Yeah, that's fine. It's a little harder, but
It is, but even if you sit like this temporarily, it doesn't hurt you, does it?
No, it doesn't hurt. But just try to engage that core as much as possible, of course.
And stand up, great alignment. And if you don't know what your alignment is, put your hands above your shoulder, drop your shoulders, and also look at yourself in a mirror. You can tell if your back is too arched, if you're popping your behind too much. You can look at all of that, right?
Right. And what I tell my patients is at the end of a day, of a work day, a 9 to 5, when they're on their computer, that's another thing where you have to really look out for your posture, but have their coworkers sneak a picture of them from the side or from the back when their muscles are tired and fatigued throughout the day. And then you'll see what their posture truly is. And you'll see a lot of people like this, leading to neck issues, back issues, and shoulder issues as well.
And one thing that we've talked about on Healthline too is for every hour you sit at your desk, stand up for 10 minutes.
Of course.
And stretch.
Yeah.
Do some full body stretching, and even if your feet are under your desk, you can go like this, because it just keeps the machine moving.
I love those foot pumps.
So
keep those foot pumps up.
When I hurt my shoulder, I tore a ligament. I've seen doctors that we've talked about.
Yep.
You've given me the thumbs up on them.
Oh yeah, very good.
Sometimes you just hurt your shoulder and it's not a rotator cuff tear. It's bursitis. It's possibly arthritis. What's the differences between the signs and symptoms on these?
Right.
So somebody doesn't think, oh my gosh, I have a rotator cuff tear and I have to have surgery, and it could just be bursitis.
Right, and that's sometimes a tough thing to distinguish because the symptoms overlap. But a big thing that we need to know is the history.
Sure.
So what happened? Did you feel something? Did you hear something? Were you holding something and it just dropped? Or were you trying to break a fall? So those are key components in telling us if there's an acute kind of injury like a partial tear, or if it's just something over time, like an inflammation, like a bursitis. Bursitis is basically the little tissue between the rotator cuff and the acromion. The acromion is a bone on top of the shoulder blade here, and there's a little space underneath where your rotator cuff glides smoothly. So when that space in between is inflamed, irritated, it can cause pain, especially pain.
Gives you an impingement.
Impingement, correct. Right when you get to this point and anything higher, if that causes pain, that's usually impingement. That's the most common shoulder issue.
Bursitis is hereditary, yes?
No, bursitis is some genetic component, but it's activity related as well.
Okay, and what about rotator cuff tears? Can any of that be?
That is also genetic. Also, another key thing is your cholesterol. So if you have a high cholesterol level, that actually affects the tissue quality in your rotator cuff muscles. It's like a rubber band that can't really bend as much.
Not as pliable.
Yeah, not as pliable, exactly. So if you leave it under the sun and then all of a sudden you want to stretch it, it'll pop, because the quality of the tissue is different. So we've known that cholesterol affects the quality of tissue. The lack of use affects the quality of tissue. There is a genetic component as well. And of course, overuse.
Okay. So for those of you that have high cholesterol, go to the doctor, get your cholesterol checked. And for those of you that just sit and do nothing, get up, get out, and start moving. We're like a car in a parking lot. And if you're an empty car in a parking lot and the sun is beating down on you, beating down on you, beating down on you, you're not going to start.
That's exactly right. Your battery runs out at some
You
point.
do, and we just,
Yeah.
you know, a lot of people, we talk a lot about obesity on the show as well. We're the most obese country in the world, and it just doesn't happen. So you just don't end up sitting like this. You do it every day, and there are simple solutions to, as I said earlier, leading a healthier lifestyle.
Yeah, I mean, staying active, being motivated to move,
Engaging your core.
Encouraging movement. It's key. Orthopedics love people who want to get up and move and have a healthy lifestyle. We wholeheartedly promote that and support that.
How do you treat bursitis?
Anti-inflammatories is the first key
Such
step,
as?
such as ibuprofen, Advil, Aleve. Sometimes
Okay.
we have patches. Sometimes
Okay.
we have gels for people who have stomach issues.
Okay.
Physical therapy, just to
Right.
work on some range of motion, stretching. Steroid shots
Okay.
are key in recovery for this. But that's usually it, and usually with time. It'll get better with time usually if you're doing those things and modifying your activities. Now sometimes it doesn't go away.
Sure.
And that's when there may be a structural problem
Okay.
that's causing it. So sometimes that undersurface of that acromion bone that we talked about hooks down
Because
into the rotator
this is
cuff.
proper acromion bone sticking
Proper
out.
is flat.
This.
Sometimes it gets like this, and other times it's a full-on semicircle. So sometimes we have to go in with a very small procedure with a camera and a shaver and take out one of the hooks, essentially.
Which will be done to me in a month. In regards to treatment with bursitis, same thing with arthritis, true?
Well, arthritis is a little different. It's more of a progressive kind of change that occurs. Arthritis essentially causes pain and stiffness of every joint. That's what it is. Now, how that happens, we don't really know. It's genetic and also overuse. But then you have all these pro athlete tennis
Sure.
players who don't have shoulder arthritis at the age of 30, like Andre Agassi, Novak Djokovic, people like that. So there's definitely a genetic component. Biomechanics is key. And for arthritis of the shoulder, that's going to be a lot of stiffness, pain, a lot of what we call crepitus or clicking and catching when you're kind of moving and rotating your shoulder. You'll see with arthritis that one side you can rotate out a lot and the other side not so much. And you'll think, well, why is there like a block? And that's when arthritis is kicking in. It's actually creating new bone, causing a bony block to the motion.
In regards to treatment, though, inflammation,
In regards to
injections.
treatment, a lot of the similar treatments
Similar.
are key. We again encourage movement, but again, anti-inflammatories, physical therapy, steroid shots. Sometimes we do PRP or stem cells.
which we'll talk about in the next segment.
Sure. And surgery would be a last resort.
More with Dr. Bastian when we come back. And one thing that got to throw out there, that as I do all the time, is talk to your parents, find out your family history, find out what grandma and grandpa had, find out what mom and dad have. The more information you know from them, you'll then know about you, and then you can give to your doctor, and more solutions are available. Don't go away. Welcome back to Healthline. Did you know that Adventist Health Glendale has been recognized by U.S. News and World Report as one of the best hospitals for 2018-2019, ranking 15 out of 133 hospitals in Los Angeles and 28 out of the 414 hospitals in California. Adventist Health Glendale recently received their 8th A grade in a row for patient safety from the Leapfrog Group. Adventist Health Glendale, once again, as I say to you all the time, congratulations, and it's respecting your mission statement. Whole person, living a happy, healthy life. Whole person care. Joining us from Adventist Health Glendale, Orthopaedic Surgeon, Dr. Sevag Bastian. Doctor, so bursitis, arthritis, signs and symptoms kind of similar.
Right.
In regards to a rotator cuff tear, can you have a tear without having surgery?
Sure. I mean, can you treat it, you mean, without
Yes.
the surgery? You certainly can. So there's actually studies out that show that some people even have tears and don't even know it.
Okay.
Because they've compensated so well with all the other muscles and therapy and their own therapy. Actually, 54% of people over 60 have a rotator cuff tear and don't even know it. There are other muscles around the shoulder that can help compensate. And if we can avoid a surgery and do the therapy, that's great. You may always feel a little weakness when doing things up here, like reaching for that top shelf book or that gallon of milk in the refrigerator. But generally, when it comes to everyday things, a lot of people are unaffected by it or don't feel it as much, and they just kind of let it be, and it doesn't bother them.
And God bless you, because the rest of your body and the rest of your shoulder is holding that part of
Exactly.
your shoulder.
Like we said, the core,
The
the periscapular muscles, the muscles around your back and your shoulders, they can all kind of help play a part.
You go in and see you, and unfortunately you get the news that you have to have rotator cuff surgery. What does that look like?
Right, right. Well, sometimes you need it. Sometimes therapy's not enough. Sometimes you're a high-level athlete or it's affecting your day-to-day and it's causing a lot of pain, such as yourself. So we'd like to go back in and reattach it. So if it's torn, it detached off the humeral head or off its insertion point, we'd love to go in with a camera. It takes 2-3 small incisions about 2 centimeters long.
Because a lot of people think when they think surgery that you're going to go in there and carve through the shoulder, and they're arthroscopic.
Yeah, it's all arthroscopic
Okay.
these days. We tend to avoid big open surgeries for this.
Right.
It takes 3 arthroscopy portals, which are about 2 centimeters long. One's for a camera. The other 2 are just to kind of help shuttle our sutures through and anchors. And we actually attack the tendon that's ripped off. We suture it. We get the fiber wire sutures that are locked in there nice and tight, and we put it into an anchor and drill it into your bone. So it pulls it back over and into where it's supposed to insert. It takes a few months to recover. We go gentle with the therapy, depending on the quality of the tissue and how long it's been torn. Those all kind of play a factor into the healing, as well as smoking. Don't smoke.
You know who we're talking about. For all of you that have a cigarette in your hand or have lit up today, put your cigarette down. You'll heal a lot quicker, and you'll live a lot longer, just saying.
It's definitely true. So orthopedics and smoking just don't go hand in hand. It increases your risk of infection and not healing. But there are other factors as well that go into it. Sometimes we supplement the surgery with additional things to help boost the healing process.
Something that I've been talking about is something called the bovine patch.
Right. So we do simple things as like PRP. We take bone marrow from the actual bone over there and infuse it into the joint. But we also augment the repair sometimes with a bovine patch. It's acellular, so it doesn't really have any live cells in it, and it's collagen-based, which is a fancy term for the proteins that make up our tendons and bones, really, but it's a specific type of collagen. And we put it on top of the repair site. And what we think is that it helps relieve some of the stress. So the stress isn't on this repair site because it can re-tear. Highest chance of re-tearing is in the first 3 to 6 months. That could definitely happen. So by the time it grows roots into the bone, because we're just slapping it on, but it needs to grow roots. And by the time it grows roots, we put this patch on to help with that overlap of time, and it helps kind of distribute the stresses. It also helps induce healing. It brings growth factors in, and it acts as a scaffold to help with the healing process. And the body kind of absorbs it and it gets rid of it within 6 months to a year. So it doesn't stay long.
I've heard you heal quicker with it.
Correct.
You're a bit stiffer with it.
Right.
What is the most important thing in regards to rotator cuff surgery and recovery?
Most important thing is to listen to your doc. Because
Say it again.
Most important thing, listen to your doc. If it's an easy, simple little tear that has just barely peeled off, that changes the therapy with respect to what you do, when you can start moving it, how long you'll be in a sling. If it's been torn for a while, or if it's a large tear and it's sucked back in and it was really hard to bring it back over, then your therapy is going to be delayed. It's going to be slow. You're going to be stiff, because we rather you be stiff than need another surgery and go back in because you retore. So there are different degrees of rotator cuff. Just because it's rotator cuff tear doesn't mean they're the same. No two are the same. And how it looks inside affects your recovery. So in general, you're looking at a sling for about a month, 4 to 6 weeks, then gentle motion during that time, and then after 6 weeks to 12 weeks, you're looking at motion, trying to get the motion up. Strengthening won't start for at least 3 months until you're confident that that insertion site has started to grow little roots. And it takes about 6 months for it to be about 85% as strong as it's going to be. And at 3 months out, it's only about 50% as strong.
Sure.
So that's when you start feeling good. Your pain is okay.
And that doesn't
you're getting your
mean
motion
going,
back.
And that doesn't mean though going out and redoing something, because a lot of my friends
Right.
have had the surgery, But they had to go back in and have another surgery because they got too excited.
Right.
Like, oh, this doesn't hurt. So bottom line is pay attention to your doctor.
Listen to your body. And again, the 3 to 4 month mark is when you start feeling good, so you start doing a bit too much. But the repair site is still very tenuous, very fragile, so it could pop very easily. Don't do too much. Listen to us. We mean well.
Doctor, before we wrap out, can you share with us just some simple shoulder stretches that help engage our shoulders and keep us strong?
Right.
Before
So
we head out.
The key is not to do anything too far away from your body with your elbow straight. That's putting a lot of stress on your shoulders.
Okay.
You want to try to keep it in. Keep it in front of you,
Okay.
and keep it waist level.
Okay.
Heavy things around the house, bring them down. Don't reach up for it, bring it down. Don't leave your milk on the top floor of the fridge, put it on the bottom. As soon as you start coming up here and trying to do things of significant weight, that's when you start really overdoing it on your shoulder.
Okay.
And if you have a tear, it can get bigger. If you have a tear, it could hurt. You feel weak, you can drop things. So just simple things to avoid. With respect to kind of getting your therapy up and making sure you're ready for things and keeping warm, try to do exercises on your back. So when you're laying down on your back on a rough surface, it supports your shoulder blades.
And there's not as much stress.
And not as much stress. You can do all sorts of jumping jack motions, shoulder motions, whatever you want, as long as you're on your back and your back and your scapula are well supported. So those are highly encouraged. Those are good exercises to do after your surgery. For you, they're going to start real slow and do gentle pendulums, which is, and if you excuse me, it's when you kind of stand up, drop your shoulder, and you kind of just do small circles like this, and then you can kind of make the circle bigger and bigger and bigger. These are good exercises to do after a rotator cuff surgery or after really any shoulder surgery. And good way to just keep the shoulder loose.
Doctor, thank you so much. Is your cord tightened? Okay, what?
Way to remind
me. For more information, please visit Dr. Bastian at Adventist Health Glendale. And you can always find us on social media, on Facebook at AH Glendale, Twitter at Adventist Health, LinkedIn at Adventist Health, and you can always visit the website adventisthealthglendale.org. Hold in. Deep breath in, deep breath out. Remember, the most important conversation you're going to have is about you and your health. So have one right now, and together just take your arm and just stretch it out just a little bit. Now this side. In. Maybe go up just a little bit. And out. We'll see you next time. Have a great spring.